on the pharmaceutical strategy, which is the second pillar of the European Health Union. Let me first express my hope that you're all following this press conference in good health. I'm very happy to tell you that the strategy will be presented today by Vice President SCHINAS and by Commissioner KYRIAKIDES. As usual, they will make a few opening statements and then we'll be happy to take your questions. Vice President, please.
Thank you. Today, together with Commissioner KYRIAKIDES, we are proposing a new pharmaceutical strategy for Europe. It is a strategy that aims at ensuring affordable, safe, quality, innovative, and solutions-oriented pharmaceuticals for all citizens in the EU. By presenting the strategy today, we are also honoring the commitment made by President von der Leyen, both in her political guidelines and in her State of the Union speech in September. Today's package is yet another building block of what we call the EU Health Union. It follows our work on the package that we adopted on the 11th of November, where we proposed to modify the statutes of our health agencies, the European Centre for Disease Control, ECDC, and the European Medicines Agency, where we also reinforced the crisis management aspects of our work. And this package also adds to the incredible work that we have been doing on vaccines and will be followed early next year on our cancer action plan. So as you see, we have building blocks, solid building blocks emerging to build this health union. For those of us who have a historic view of EU health policy, the work of the von der Leyen Commission in our first year of office is something akin of a small miracle. We are doing things that would be unimaginable 5 or 10 years ago. Who would have told people at the time that the moment would come that Europe would pre-purchase vaccines for all Europeans from all companies producing them or about to produce them? We are exploring every inch, every centimeter of our competence under the treaties to make this work, because we know that when it comes to health, people want Europe present, not accessory in health policy. Of course, I'm not discovering the wheel when I say that the pandemic was also an accelerator in all this work, because it clearly showed us our limitation relating to data availability, the supply of medicines, our manufacturing capacities in the EU and the production of medicines. We do not want to see, never again, the problems that we faced during the first weeks of the pandemic. Never again. And with this pharma strategy, we take a first meaningful step to avoid this from happening again. The package that the Commissioner will present in more detail in a while has 3 main strengths. First is, I like this word because it's a Greek word, it's anthropocentric. It centers on people, on patients. We are responding concretely at what patients need, and what patients need is real and affordable access to medicines. Secondly, we are balancing this also with support to EU pharma industry. These proposals would allow us to boost the competitiveness and the innovation potential of one of our very strong industrial arms, the European pharmaceutical sector. And finally, our proposal addresses one of the key lessons learned from the pandemic, probably the lesson of the pandemic, which is the need for Europe to build open strategic autonomy. We need to be able to rely on ourselves, not on others. And let me say and conclude a few words on the patient-centered nature of this strategy. As I was saying, our aim is to deliver for patients by fulfilling unmet medical needs and ensuring accessibility and affordability of medicines. We want to prioritize research and development, incentivize innovation, including on neurodegenerative and rare diseases and cancers. And we will invest a lot by not only investing, but also on breaking regulatory silos that have been a traditional problem in this area and modernize this legislation by improving medicines and supporting generic and biosimilar medicines which are cheaper. To conclude, overall, with our today's package, we are addressing the ongoing trends by building a pharmaceutical sector that is more respectful of the green transition. We're making the most of the new technologies and acknowledging that longer lives of Europeans create further needs for medicines and long-term care. At the same time, with this strategy, we're addressing persisting weaknesses, systemic weaknesses, and those accentuated during the pandemic, to be better placed in the future should we find ourselves in the unfortunate situation we are now. Let me finish by highlighting a final but very important element. With the adoption of this strategy, we will be completely overhauling the entire legislative framework about medicines, pharmaceuticals, and their placing in the market at the European Union. This is a set of rules that is 20 years old, and it badly needs modernization. But this will be a long process. Today is only the beginning of this vast chantier. Concrete proposals will be presented not only the next 2 years, but this is a strand of work that will take us basically throughout the mandate of this Commission. Our ambition is to leave behind a solid, modern EU legislative frameworks for pharma. And ladies and gentlemen, this would allow us once again to affirm that the EU Union for Health is not just a soundbite or a slogan. It is a reality. It is an emerging reality. And we can now say with confidence that we have the first building blocks that would allow us to defend that the EU needs more cooperation, more coordination, and definitely more EU centrality and presence in this area. Thank you very much. Stella, over to you.
Thank you. First of all, may I start on a personal note and say how really happy I am that I find myself here today at this press conference with Vice President SCHINAS, having recovered and recovering from his recent COVID-19 experience. It's good to have you here next to me at the podium, Margaritis. So good afternoon to you all. We have often said that having universally affordable, accessible medicines is not just something that we should be working towards, but it is a fundamental right for patients and for citizens. And this is what we are here to present and share with you today, because we will be sharing with you today a pharmaceutical strategy that will be as the foundation of our work over the next 4 years. Now, COVID-19 has really shown us the importance of having affordable and accessible medicines, especially in a case when health systems are under pressure. But I remind myself and us all that having a pharmaceutical strategy, developing a new pharmaceutical strategy, was in fact in my mandate letter 1 year ago, which seems, of course, so much has happened since. But it was something that was already understood and demanded by the European Parliament, by the Council, that we needed to move in a different direction in terms of a strategy for pharmaceuticals in Europe. And COVID-19 clearly showed us the necessity. We have also seen how much we can achieve through our emblematic work on vaccines when we use innovation, when we use technology, when we give the right incentives, how we can move quickly forward. And we, as regulators, and this has really been, for myself, as Commissioner for Health and Food Safety, a key priority from the very beginning. So the pharmaceutical strategy for Europe is our response to the vulnerabilities that we have seen highlighted by COVID-19, but I would say not only, because we knew that these issues affecting affordability, accessibility and shortages of medicines were already issues that were very important to member states. This is a strategy that will be able and aims to deliver at all times for patients, for an industry, and this is important, that will continue to be a world leader and a European champion. And this is a strategy that will be one of the cornerstones of our European Health Union. Ladies and gentlemen, there are currently over 7,000 citizens in the EU living with rare diseases, including many of them with rare cancers. And it's a shocking number to know that 95% have no treatment option. And what this means is that these patients and their families have to live with the reality of not being able to be relieved from pain or having access to a cure. Many of these also involve children, because we're talking also about pediatric cancers. And there is nothing more devastating than to have knowledge that you are facing a rare disease or a very serious disease, and you either have no medicines that you can turn to, or that there are medicines out there, but they're not accessible to you. So we need to do a great deal more, and we need to put things down now. At the same time, what we saw with COVID-19 was the actual impact of antimicrobial resistance. We've discussed it so many times before. And we have said so many times before that over 33,000 people die from antimicrobial resistance every year. But COVID-19 really highlighted the serious issues to do with this. And lives are lost because the market is failing, because we don't have the development of new antimicrobials. There are too many patients and citizens in the EU today, in 2020, that are still suffering due to an absence of treatments. We're losing lives. And at the same time, the EU is a global leader when it comes to pharmaceuticals. In research alone, medicine producers contribute to research and development with over 37 billion euro. They provide over 800,000 jobs and generate over 110 billion in trade surplus. So our pharmaceutical sector is strong. We already do have a good level of care in many areas of the EU, but we can deliver more and we can deliver better. We need to look at innovation because it is at the centre here. We need to use digital transformation and scientific breakthrough. We need to use promising treatments. We need to move. We're at the time now of personalised care. We're at the time now when we need to be able to use gene and cell therapies. And regulators we need to look as regulators to see how we can move forward so that we look at the boundaries that need to be in place now and what has been put, not what has been put into place over the past many years. Now, I will not repeat what Vice President SCHINAS has already said. It will be based on 4 pillars on competitiveness and innovation in order to make personalized treatments more available to patients. It will focus on access to affordable medicines, because really, in fact, innovation only makes sense if it is available and affordable to patients. And it will also be looking at an EU open strategic autonomy by ensuring supply chains and addressing shortages in Europe. And we saw how this was challenged in COVID-19. We have already launched a dialogue on this to have a clear understanding of the supply chains and the shortages, and we will be looking at an ambitious reform of our legislation by 2022. And finally, we need to ensure that we maintain a strong voice in the global stage and a level playing field. And this is also included in the strategy. So ultimately, in ending, I would say that what the pharmaceutical strategy aims to ensure is that Europe is a place where medicines are developed, manufactured, made available in an affordable way to all patients who need them, regardless of where they live in the EU. We cannot do this alone. The Commission cannot do this alone. We need the support of Member States, of the European Parliament, of NGOs, of patient organisations. But, ladies and gentlemen, I've stood at this podium countless times over the last few months when dealing with this pandemic crisis, and I have heard and shared with you the many expectations, the many concerns, the many anxieties, that we need to do more in the area of public health in our Union. And that's why we presented EU for Health. That's why we went forward and presented the European Health Union. And that is why we're going to be shortly coming forward with the Europe's Beating Cancer Plan. Because we have been listening, and we're listening to European citizens. And all these are parts of the new European Health Union. One that is citizen-centred, one that will be patient-centred, and one that will deliver what citizens expect from us. So today's strategy is to build a stronger Europe in the area of health, and it is another step in what we want, which is to deliver what citizens expect from us, especially at a time of crisis. Thank you.
Thank you, Commissioner. Thank you, Vice President. We'll now take questions. I see that Laura had a question on skiing holidays. Laura, I will take this question in a few moments, but I will first give the floor to your colleagues who may have questions indeed on the pharmaceutical strategy. So let me maybe first give the floor to David CARRETTA. David, go ahead.
Thank you very much. In fact, it's a question on vaccine. I don't know if I can go ahead.
Yes, go ahead. Go ahead, David.
Thank you very much. David Carretta, Radio Radicale, Italian radio. The first question is on vaccine and the strategy you have put forward some weeks ago. You have asked member states to present national plans, and you have promised to make an evaluation of those plans. I'm wondering at what point we are in this evaluation. Do you think that, for example, Italy is ready, since there are news of problems with needles and so on? And if you think that you should deploy vaccines also in countries where authorities are not ready to proceed to a big campaign of vaccination. And the second question, it's on the issue of the ski season, because the Italian government has asked the Commission to act, to coordinate or to make some decision also for other member states. And I'm wondering if you have anything to say on that issue. Thank you.
Okay, thank you.
Now, on the issue of the vaccination plans of member states, yes, vaccines are important. Safe and effective vaccines are important. But what is actually crucial is vaccination. And this is the reason why since October we started working with ECDC and member states in order for them to have their vaccination plans into place. Europe needs to be well prepared for this vaccination. This means that member states need to have the necessary infrastructure and the logistics, so when there is a safe and effective vaccine, they can roll it out and deploy it as quickly as possible. From the information that I have is that all member states have so far responded on the development of their COVID-19 vaccination plans. 6 member states have so far published the recommendations of the priority groups that they will be vaccinating, and around half of them have provided information on the logistics of their deployment, but we're working on that constantly. You must understand that this is not something that will happen it's not static. It's an evolving situation that we're looking at constantly with member states, because what we want is that when a safe and effective vaccine is authorized, to ensure that member states will be ready. So this is the current situation. We have also moved forward with joint procurements for large-scale vaccination supplies in order to support member states for this. In terms of other countries, I think there was a question for that. I wasn't sure.
I think the other question was on the skiing situation.
Oh, the skiing situation. Well, I'll say what we have said before since April, when we presented the roadmap in April for the on the phasing out of containment measures. Now, we all know, we can all see from our everyday lives that the lifting of restrictions too early can lead to an increase of the number of cases. This approach still applies today. There is no one-size-fits-all. Different member states have different realities. So we need to have a gradual, I would say, science-based and effective way of lifting containment measures. Until a safe and effective vaccine is available and we are able to vaccinate a critical mass of the population, we are urging member states to continue their efforts to mitigate this pandemic, because this is the only way forward. And in this way, they need to continue with their actions on preparedness, on testing, on contact tracing. We have put out guidance for this, and this continues to be in place. Thank you.
Thank you. Thomas Spekschoor, goedemorgen. Thomas, go ahead.
Also a question for Commissioner Kyriakides on diversifying the supply chain. The Council and the Parliament are saying for years now that the EU needs to do this. So now you will have another dialogue with the industry. I've spoken to several people in the industry who are saying we don't have another 2 years. It's just going to be too late. Please come up with these regulations now. Why does it take another 2 years?
It takes another 2 years because we need to know exactly how we're going to move forward. First of all, in order to be able to address the issue of shortages and supply chains and the disruption, you need to be able to understand what the root causes are. This is why we have already launched a study in order to understand and see the root causes. And after we are able to do that, then we can come up with proposals. So, in fact, one could say, why are we coming forward with this strategy now? Because we need to start early, immediately. We already have left it. It has already been there for too long, and now we're moving forward with this now. So what I would say is that in order to be able to change the pharmaceutical legislation and in order to be able to address these issues, which have been there for a very long time, we need to be able to understand the root causes and come forward with proposals that will last into time as well.
Thank you. Natalia Segura. Go ahead, Natalia. You have to adjust your mic source, apparently. Yes. Yes.
Do you hear me now?
Yes, we hear you. Welcome.
Okay. Hi, good afternoon, commissioners. I wanted to ask on the strategy, and especially on the shortages and the what do you want to do on diversifying supply chain? I wanted to know if you could elaborate a little bit more on this intention to diversify the sources, especially on raw materials for medicines, because in the strategy you mentioned that, for example, that Africa might be an important partner to cooperate on this field. So I wanted to know if your intention is to bring closer the production of raw materials critical for some medicines. Thank you.
I probably have a go on shortages in general, and then the Commissioner may come in on the more specifics of raw materials and diversification. We said that the main objective of the strategy is to ensure that medicines are available to patients in need at all times, not only in normal times, but also in times of crisis that clearly exposes our vulnerabilities. And that's what we saw in the first weeks of the pandemic. Without the right medicines at the right time, we cannot treat diseases or conditions or provide life-saving medication. But the causes for shortages are not easy to understand and are not unidimensional, if I may say so. They are complex. And to address them, we need to have a very clear overview of the challenges and the issues at stake. You mentioned some of those. So to be able to attack at the sources of the shortages, we have launched a major study precisely to better understand the root causes of medicine shortages. And this is a study that we expect to have finalized next year. But that will not stop our work to continue addressing the need for continuous supply for the companies and what would the requirements be for that. And as I was telling you earlier, this is the first step. We are now opening a process that would bring us down to specific legislative initiatives, and these might include obligations of supply, earlier notification of shortages, enhanced transparency of stocks, anything that we can front load to allow us to act earnest.
Yes, thank you. I'll just add to what Vice President SCHINAS said just on the second part of your question. Vice President SCHINAS and I both in our introductions spoke about strategic autonomy, and I want to be clear here that protectionism is not in the DNA of the European Union. That said, our open strategic autonomy is a major political objective of this strategy, and I would say it's also a lesson learned from the COVID-19 crisis, and I personally know what this means when we had export bans from third world countries and found out that we were dependent on APIs and other medicines totally from other parts of the world. So we need to move in a different direction, but we will, of course, be remaining open to trade. But we need to gain a better understanding of the supply chain and understand its vulnerabilities, assess, and then be able to move forward with the changes that we need to do. So I hope that this answers the question. On the general issue to do with shortages, I'll just add that it's a very complex issue, and this is why, as Vice President SCHINAS has said, we've launched a study on this. But what I want to assure you is that patients remain at the center of this process and evaluation. Thank you.
Thank you. Susana Freixas, please go ahead. The floor is yours.
Thank you, Susana Freixas, SICN Expresso Portugal. Actually, I have a follow-up question to David, a question following what David said, because in the communication of the 28th of October, the Commission says that the first review on national vaccination plans will be presented in November 2020. So actually I'd like to understand if you are still going to publish this review with more details, well, compared to what you just said. And this leads me to a second question, because, well, we are almost in December and you still don't have those vaccination plans that you asked a month ago. So those countries that still don't have a vaccination plan are still already late. And are you worried about this?
Commissioner.
When we're dealing with an unprecedented health crisis and we're dealing with a pandemic, I would never say I'm not worried about anything. I've learned to be alert and to be able to respond to challenges. But what I would say is that we do have feedback from all member states. We do have feedback from all member states. We went forward in October. We asked them for their feedback by November. We do have the feedback from the member states. ECDC will be publishing its feedback in the coming days and weeks. And what we also need to understand is that this is an ongoing situation. This is not something that we will suddenly have the data and we stop monitoring it. You need to have the data, you need to monitor it, you need to see it's implemented, and you need to follow it up. This is not finding a safe and effective vaccine and having it authorized is one small, important, vital, hopeful step in a huge chain of events. And we are going to be looking at this 24/7.
If I may add to what the Commissioner just said, this morning the President in Parliament, of course, she mentioned the need for Member States to now start organizing the vaccination plans. But I think, Susanna, that under no circumstances this should be interpreted as a political argument of attacking those who haven't done yet, because it's a bit like the dog that bites its tail. I have followed a bit this debate, and many member states that were very early in presenting their national vaccination plans, they also got criticized for doing this without having the vaccine in place. So we should avoid to go into a situation where there will be an assessment board or who is too early or who is too late. As the Commissioner said, what matters now is for all these plans to be in place. We have assured an extensive, a formidable portfolio for all citizens in the EU from all potential vaccines that are doing well. I think that we should now concentrate on delivery, because it's very clear that what saves lives and what will ultimately save lives is not vaccines, is vaccination.
Thank you. Thomas Minierina, the floor is yours. Your mic is not working. We see you, but we don't hear you. We still don't hear you. No. It's good to see you, but with sound it would be better. Do you see any? Jonathan, anything with the mic? No. Otherwise, I'll take the next one. Thomas, there seems to be a bit of a problem. We still don't hear. What I suggest is we'll come back to you, or otherwise you can send your question in the chat box, and I will then go to the next colleague, Maria Psara. Maria, go ahead.
Hello to all of you.
Hi.
I have three questions, if I may. First, for what Vice President SCHINAS said about the Europe's strategic autonomy. How can this happen? Commissioner said that it is political choice, first of all. So my question is, we have seen at least two European councils via teleconference for coordination. We have seen councils trying to coordinate member states. And still today, we have different restrictions and measures between the EU countries, and there is no a common, view about what will happen in during Christmas time. So, what exactly do you mean by strategic autonomy? The second question is for Commissioner Kyriakides. Every year, you said, around 33,000 patients die because of antimicrobial resistance, because companies think that it is not profitable. How can this change? And the third question, if I may, last one, I promise. Today, Commission President said that European citizens will start to be vaccinated before the end of the year. Can you elaborate a little more on that? I mean, when do we expect the first vaccinations on the European territory? Thank you.
Thank you, Maria. Maybe you'd like to
have a go at the autonomy part, and probably Commissioner take care of the vaccination and the other question. On the autonomy, I said, well, it's not me that I said it, but it's, I think, universally acknowledged that this is probably the main lesson of the pandemic, that Europe should be at all times, normal times, but also crisis times, to be able to rely on a certain capacity when it comes to not only personal protective equipment, but also medical equipment, raw material, drugs, pharmaceuticals. It's important, it's vitally important that we are planning ahead. We should not hide behind our figure to say that this was not the case at the early stage of the pandemic. And I use the we in the broadest possible sense, that we found out that no one was practically manufacturing masks in Europe, that many raw materials were produced at a rate 80% out of the European Union. We were struggling for ventilators. We were facing export bans between our member states. So all this is what we need to change. This is not rocket science. The call for EU strategic autonomy is precisely that, to make sure that we have the capacity, the resources to identify what we need, act quickly, act in a coordinated way, play as a team. I'm confident that this is now emerging. I don't dare say as a certainty, but I think as a point of convergence between all our member states. A final point, I think the Commissioner said it earlier. No, we do not see this call for EU strategic autonomy as a backdoor to protectionism. We will not do that. This is not the European way. We have in the European Union 35 million jobs depending on exports. So we are very aware of the parameters of this operation, but we are also very hopeful and encouraged by the political winds that are very favorable to move in that direction.
Two other questions that Maria raised. One was AMR. I had also mentioned it in my opening remarks. It is indeed a major threat. We have known that, and it's a major threat globally. And I have always also called on other global partners. For example, last week I had a call with the Australian minister, because everybody needs to be part of this in order for us to tackle AMR. There is one of the reasons that we have a difficulty with antimicrobials is there are several reasons. One of them is overuse and misuse, and the other one is that we have a weak and challenging businesses who don't want to invest in new antimicrobials. So the strategy will be addressing this in two ways. One, to reduce the use of antimicrobials rather than misuse, and encourage appropriate use of antimicrobials. And secondly, to incentivize the development of new antimicrobials. And we were doing this with both legislative and non-legislative measures. For your second question, of course, yes, President von der Leyen said that we could start vaccinating by the end of this this year, by the end of December. We are awaiting to see when the different companies will be submitting their files to EMA for assessment. And all being well, once we have the assessment of the dossiers, we will be, not at the cost of safety at any time, moving as quickly as possible in order to be able to have the EMA assessment in the coming weeks after the dossiers are submitted. But this depends crucially on when companies submit their dossiers to EMA, so that if there are any questions whether that has already been done, as far as my information is until today, we so far haven't had submissions.
Thank you. And I see that Thomas has managed to send us his question through the chat box. Sorry about the mic problems. He has 3 questions. I have noticed the reference to the European Defence Fund as one of the funds that could promote innovation in the pharma sector. Does this mean there's a concern for the defence and security implications of pharmaceuticals and vaccines? Second question, is there any progress in the possibility that members of the European Parliament from the Health Committee be given some access to the vaccine agreements negotiated by the Commission in exchange for a non-disclosure commitment? And then finally, but I think, Thomas, this question has been replied to. You asked about the ski question, but as Commissioner KYRIAKIDES has replied to that question. So there's a question about defense aspects of the pharmaceuticals and vaccines and giving access to some members of the Parliament.
Yeah, I will take the first question because the reply is very short. The answer is yes, obviously. There is a link, because availability and accessibility of pharmaceuticals is an issue of clearly strategic importance. It has a direct link to our security, not only to our prosperity and to longer lives, and we will mobilize everything we have to make the resources available to achieve our goals, including the Defence Fund. On the Parliament, the Commissioner knows a lot.
On the Parliament, of course, we have said before that we cannot legally disclose information which is contained in the contracts which is protected by confidentiality clauses. But of course we are, when I say this, fully accountable towards all the European institutions and the European citizens, and I can assure you that we're acting in full compliance with all applicable rules. Within the contractual constraints, and I have already said this when I was in Parliament a week ago, we are ready to explore making information from the contracts available to nominated members of the Parliament with specific arrangements once the sensitive ongoing negotiations are concluded.
Yes, of course.
If I may add the final touch to my reply, which was indeed very short, so that Thomas has the fullest picture. Thomas, we're having on the 15th of December a major package on security. Some of the things that I can say now very succinctly, we will be able to analyze and present in more detail in our package of the 15th of December, namely the links with security.
Thank you, Vice President. Thank you, Commissioner. And with this, we have come to the end of the press conference. I would like to thank the Vice President and the Commissioner. I would like to thank the interpreters who are always doing an astounding job. Thank you very much. Stay healthy, and we'll definitely be in touch. Bye.